An important factor that is often not, in my opinion, sufficiently highlighted within the guidelines is the importance of monitoring of growth. Whilst everybody talks about growth within our diagnostic protocol, saying you need to assess growth, what is also important that we need to continue monitoring. Now, I know for anybody working in pediatrics, growth is part of your normal pediatric practice. The reason why it's even more important in terms of cow's milk allergy is that certainly the data that we've produced is cow's milk allergy in particular affects growth, weight for age, and also if you combine that together with multiple food allergies and a non-IgE mediated allergy where there might be inflammation, in particular height growth can be impacted. So what is really important is when you take cow's milk and its derivatives out, is that you have a monitoring process in place. And the monitoring process is not only about symptoms. The monitoring process is, as you're taking a primary nutrient out, is that growth continues. Growth is also a great proxy marker for ongoing inflammation. So we often have symptom improvements, but that you have a child, for example, that's stunted, so short length, and you actually continue measuring, symptoms have improved, but the length does not catch up. So for me, that tells me whilst you might have clinical symptom resolution, there might still be ongoing inflammation. So if there's one message, please monitor growth. And for me, growth is not just weight. For me, growth means you're doing length below the age of 2, height from 2 years and above, and of course, head circumference from below 2 years of age as well. I often get the question in regards to monitoring of children, whether a food diary is indicated. So from a dietetic perspective, of course, that's lovely having a food diary, but you have to think about the sensitivity and specificity of your measuring technique. So are you going to do 24 hours, 3 days, and is it a weekday, weekend days? So as dietitians, we have those skills. And for the first appointment, I normally do it. And I often do it when, for example, I'm expecting weight to go up, but I'm actually not seeing it, to see, is this dietary driven, or in one of the previous points, is this inflammatory driven? Because at that stage, I often send them on to the specialist and saying, look, I've done a food diary. However, by doing constant food diaries, you're in fact increasing a lot of time the anxiety at home and writing down and monitoring and getting an obsession around food intake. So I generally say, outside of a dietetic appointment, advise the parents not constantly to be writing down what they're eating, because it can lead to further anxiety, and the quality of life is already so badly impacted in these children. I don't think they need another factor and pressure on the parents.